Good afternoon and thank you for joining us. Today, the national vaccination programme continues to power past the target we set 6 weeks ago, with more than 15 million people vaccinated across the UK. And once again, I pay tribute to the astonishing efforts of everybody involved. The GPs, the nurses, the volunteers, the army, and the pharmacists like Hardik Desai, who rallied local volunteers to vaccinate 3,000 people in his village hall in Ticehurst in Sussex, while keeping his pharmacy open. And of course, I thank all of you who have come forward to be vaccinated. This is an unprecedented national achievement. But it's no moment to relax. And in fact, it's the moment to accelerate, because the threat from this virus remains very real. Yes, it's true. We've vaccinated more than 90% of those aged over 70, but don't forget that 60% of hospital patients with COVID are under 70. And although the vaccination programme is going well, we still don't have enough data about the exact effectiveness of the vaccines in reducing the spread of infection. We have some interesting straws in the wind, we have grounds for confidence, but the vaccinations have only been running for a matter of weeks. And while we're learning the whole time, we don't today, as I talk to you today, we don't have all the hard facts that we need. And the level of infection remains very high, with still more people today, more people still in hospital today than in at the peak last April. And admissions across the UK, very important statistic, admissions running at 1,600 a day. So we have to keep our foot to the floor. And I can tell you that today, the next million letters are landing on people's mats right now, offering appointments to the over 65s. And we're also contacting all those aged between 16 and 64 with underlying health conditions, as well as adult carers. And if we can keep this pace up, and if we can keep supply steady, and I hope and believe we can, then we hope to offer a vaccination to everyone in the first 9 priority groups, including everyone over 50 by the end of April. And at the same time, we will be giving second doses to millions of the most vulnerable within 12 weeks of the first. So this moment is a huge step forward, but it's only a first step. And while it shows what the country can do, we must be both optimistic but also patient. And next week, I'll be setting out a roadmap saying as much as we possibly can about the route to normality, even though some things are very uncertain. Because we want this lockdown to be the last, and we want progress to be cautious, but also irreversible. So please continue to stay at home, protect the NHS, and save lives. Thank you very much. I'm now going to ask Chris to do the slides.
Thank you, Prime Minister. First slide, please. 3 slides today. The first one is just showing the number of people testing positive for COVID over time. And as you can see on this graph, the numbers are coming down steadily over time, but they're still at quite a high level and above the point where it was, for example, in September last year. So significant progress, but still quite high. Next slide, please. If we look at people in hospital in the UK, this again is coming down. Of course, this follows slightly later than the rates of new cases. Again, the rates are still very high, so they're around the point, in fact slightly above the point, which they were at the peak of the epidemic in April of last year. So these are still very high rates, but they're definitely heading in the right direction. Next slide, please. And finally, on deaths, the number of people who've sadly died with COVID remains high, but is continuing to go down. So the most recent 7-day average was 657 deaths. Still a very high number, but definitely heading in the right direction. This is now below the peak of the first wave we had last year. Last slide, please. And this slide just shows the steady improvement in the number of people who are being vaccinated thanks to the extraordinary work of people in the NHS, the people that the Prime Minister is talking about. And I'd very much like to add, as everyone would, huge thanks to the doctors, nurses, volunteers and administrative people who are making this happen. It is an extraordinary achievement. Now, I wanted just finally to say how the protection from vaccination will build, because it doesn't all happen in one go. The first layer of protection is people being protected by their first vaccine. But remember, this only starts to work sometime between 2 and 3 weeks later. People are not immediately protected. Then people will have a second vaccine, and that will strengthen the level of protection and also make it more long-lasting. So it is absolutely essential that when people are asked to go back for their second vaccine, they do so. The third layer of protection out is we're confident that these vaccines will produce some level of protection from transmission. We don't yet know exactly how much. So if people who are vulnerable meet other people who are vaccinated, that will provide another layer of protection for them. And finally, further out, once we have a high proportion of the population vaccinated, this will help to reduce the rates of transmission, reduce the risks of big surges. So this also provides a level of protection. So the more we vaccinate out in the community, the more we protect those who are potentially vulnerable. Thank you very much.
Thanks very much, Chris. Let's go to Simon Stevens, whose NHS staff have been doing the lion's share of this vaccination campaign. Simon.
Thank you, Prime Minister. 15 million vaccinations in 10 weeks would be an enormous undertaking at any time, but doing so during the course of this surge of winter coronavirus, when the health service has been under the most intense pressure and hospitals have looked after more than 100,000 severely ill coronavirus patients in just the last month, that really has been an extraordinary national team effort. And for families and patients across the country, you've been able to see for yourselves the speed and the precision with which the vaccination campaign has been undertaken. So I joined the Prime Minister and the Chief Medical Officer in thanking everybody who's been involved. Of course, our GPs, our nurses, our pharmacists, the entire staff of the health service, but also our partners, the volunteers, the local authorities, the local businesses, the armed forces, and many others who've rallied round to get us to the place that we are today. But today, as the Prime Minister said, is definitely not a mission accomplished. I've described the vaccination campaign as 2 sprints and a marathon. We've just come through the finishing line of the first sprint, and now we've got a second sprint between now and the 30th of April to extend the number of vaccinations given to the higher risk groups of the population, before then moving on to the marathon, which will be vaccination for everybody in the country who's eligible, as well as the winter flu campaign and potentially further COVID booster shots this autumn, if that's what the science suggests is needed. So perhaps I can just spend a moment on what this next sprint looks like, the 11 weeks between now and the end of April. We're going to be doing 3 things. First of all, if you're in one of the groups who've already been asked to come forward for vaccination, and you're one of the few people who haven't chosen to do so, you still can do that. So although, as the Prime Minister says, uptake has been fantastic, we thought that perhaps 3/4 of people would accept the offer to be vaccinated. For people aged 17 above, as the Prime Minister says, that's over 90%. Nevertheless, if you haven't yet taken up that opportunity, you still can do so. Get back in touch with the NHS, with your local GP, and that will be arranged. The second thing we're going to be doing between now and the end of April is making sure that people get the second booster doses for those who have already had their first dose. And that will particularly begin from early to mid-March, as 12 weeks on from the first vaccinations occurs. We are reserving the vaccines that are needed for that, and you will go back to the same place where you had your first vaccination, and if you don't already have an appointment for that, don't worry, the NHS will contact you to set up that second booster shot. And then, of course, the third thing we're going to be doing between now and the end of April is extending the offer to a larger group of people, in fact, more people in this next group than we've vaccinated in the first group since the beginning of the programme through to today. And for people aged 65 to 69, as the Prime Minister says, you will be getting letters today, tomorrow, this week, inviting you to book in for your vaccination. In the first instance, we're inviting you to consider doing so at one of the larger vaccination centres or the pharmacists who are part of the programme. But if that's not convenient for you, you can hold on and you will be contacted by your local GP. The reason we're doing that is we want the GPs, who together have done about 3/4 of all the vaccinations so far, to use the next several weeks to focus particularly on more than 6 million people who have got underlying health conditions that put them at higher risk. And given the relationship they've got with their local practice and the long-term health conditions that the GPs are already familiar with managing, that makes sense for the GPs to be focusing on that group of people over the next several weeks. Those, for example, are people with diabetes, with heart problems, with severe learning disabilities or mental illnesses. If you're in one of those categories, your GP locally will be in touch with you, asking you to come forward for vaccination. But we're also going to be offering vaccination to younger adults living in care homes or communal settings, as well as to eligible adult carers. And they will be also contacted by letter through the National Booking Service. So in a nutshell, wait for the NHS to get in touch with you. Invites will be on a rolling basis when it's your turn, because in this next phase, this second sprint, actually we're going to be vaccinating a larger number of people than in the first sprint. And overall, although supply will vary week to week and we'll have to adjust accordingly, we may be giving up to twice as many vaccinations overall, given we've got to be doing the second doses as well, than we've done in the first sprint. So I think in conclusion, a big thank you to the public for helping us get this right. An enormous thanks to staff and volunteers and partners across the health service for getting this done. And if you'll forgive coining the phrase, Prime Minister, I think what my colleagues across the health service are saying is give us the tools, the vaccines, and we will finish the job.
Well, thank you very much, Simon. We certainly intend to do everything we can to give you those vaccines. Let's go to Sarah from Basingstoke.
Given the likely need for an autumn COVID vaccine booster, and then possibly one annually thereafter, how will the NHS cope with the ongoing pressure to vaccinate millions of people quickly on an almost never-ending cycle, and be able to resume a more normal health service provision at the same time?
Well, thanks, Sarah. My instinctive answer is that the NHS already runs massive vaccination programmes for flu every year, but perhaps Chris and Simon might want to answer that one. Chris, you want to go first?
Shall I give a medical answer and
Yeah,
Simon
sure.
will give a sort of practical answer on this? I mean, in terms of COVID revaccination, there are essentially two reasons potentially to do this. One of which is if immunity is starting to wane, and we don't really know how long we will have to have between revaccinations. It might be a long period, it might be short. It's too early really to tell. And the second reason is if we end up with variants of the virus that can escape around the immunity which the vaccine provides. And there's, I think, reasonable evidence that we may have to do that this year, because there are several variants that look very similar to one another in many ways, which actually could have slightly reduced, not completely reduced, but slightly reduced, or in some cases more than slightly reduced effectiveness from the vaccine, in which case we then redesign the vaccine, scientists redesign the vaccine, and that allows to revaccinate against the new variant. But how regularly we will have to do this, and whether it has to be the whole population, or as is more common with, for example, flu, just limiting it to those who've got the highest risk from health, we'll have to see, and it'll probably vary year by year. But I don't think this should be seen as we're having to do something on this scale continuously. I think it'll be more limited and dependent on how frequently we have to do it.
So just adding to what Chris has said, I think the first thing to say is that we've obviously got many thousands of volunteers who've come back to help, and even if not all of them are vaccinating right now, over time, during the course of the year, we will be asking them to help out. This morning I was in Oxford at one of our vaccination centres. The St John's Ambulance doing a fantastic job training volunteers to help with the programme. In Coventry on Friday, where I was talking to a retired nurse who'd come back to help. So I think we can expand the number of people who are helping over and above the usual NHS workforce. And as vaccine supply increases, we'd expect that more pharmacists, high street pharmacists, will be able to do more of the vaccinations as well in the way that would normally happen during a flu season.
Thanks very much. Yes, the role of high street pharmacists is incredibly important. Hannah from Glasgow.
More and more people are feeling the weight of the epidemic now and seeking support for their mental health, but feeling totally lost. I'm personally very concerned about some friends of mine who have displayed worrying changes in behaviour, but don't know where to turn. Will the government commit to a mental health spokesperson at the next coronavirus briefing to set out to the public how they can access mental health support?
Well, Hannah, I think that's actually a good idea, because there's no question that as this goes on and the lockdown continues, the stresses and strains are really, alas, I think, beginning to tell on people. And it's very important for everybody to realise that NHS mental health services are still there for you. You should use them if you need them. We've put a lot more money into supporting them, into another £500 million into supporting NHS mental health on top of the 12 or 13 billion investment. But it's very important that people make use of those services if they need them. It's also important to reach out to the voluntary sector, the mental health charities that the government is also supporting. They can be of great assistance as well. So, Hannah, I think you're making a very valid point, and we'll try and find the right person to say something about how to do this and how to encourage everybody really to look after our mental well-being and try and keep going through this pandemic, because I hope that there isn't that much longer to go now, but clearly people have been under a lot of pressure, and we've got to address that. Anything you want to add, Simon, to that, or Chris?
I completely agree, PM. Just one thing just to add, just because it's starting today, is that one of the next priority groups is people who have got significant mental health problems, so things like significant schizophrenia or significant bipolar spectrum disorders. So I think it's important that people are supported to get vaccination. That's obviously separate to and additional to the points the PM was making more widely.
And just thinking, Hannah, one of the people that we could perhaps get up to talk a bit about how we're tackling the issue is Dr. Alex George, who I've appointed as our special representative, the government special representative on these mental health issues, particularly as they affect young people. So I think we'll get Alex up and perhaps some others as well. Thank you very much, Hannah. Let's go to Alex Forsyth of the BBC.
Thank you very much. Prime Minister, you say you want this to be the last lockdown, but can you really give that guarantee given the unpredictable nature of this pandemic? And does that mean we're looking at a very gradual easing of restrictions? Should we rule out get-togethers and getaways at Easter, for example?
Alex, no, I can't give that guarantee. Of course not, because we're battling with nature, with a disease that is capable of mutating and changing. I'm increasingly confident. I'm increasingly optimistic about the sheer extent of the possibilities that are opening up with vaccinations. I'll be setting out as much of a timetable as we can give on the 22nd, and I'm very hopeful that we'll be able to go ahead and open things up, and I'll be saying that. But to say I can give an absolute cast iron guarantee that we won't face further difficulties and have to think harder and deeper about some problems, no, Alex, at this stage I can't. But I don't want people to think that I'm not optimistic. I think there's been a big change, and the big change is that science is now unquestionably in the ascendancy over the disease, and that's manifested in all sorts of ways, not just through vaccination, but also with better therapies, and they're getting better the whole time. So, people should be very, very much encouraged by what's going on at the moment, but we want to set out a timetable that is realistic, and that means one that is obviously cautious and takes account of the real state of the pandemic. Anything to add to that? No? Fine, thank you. Thank you very much, Alex. Carl Dillon, ITV.
Thank you, Prime Minister. I'd just like to find out how cautious you intend to be. Once you have got schools reopened fully, as you hope to do on the 8th of March, will you wait then to see what effect the reopening of schools has had on the rate of infections before you open up anything else? And how long might that take? And also, do you think that you will be able to announce any other lifting of restrictions at the same time as you make your announcement, whatever it may be, on schools? For example, do you think you might be able to tell people they can at least start socializing outdoors? And one quick one for Chris Whitty, if I may. I think you have said in the past, the first place that we will see the effect in the data of the vaccination program is on the death rate. Do you think we're seeing that yet? And if not, when would you expect to see it?
Carl, great questions, but again, really, as I said to Alex, or perhaps as I didn't say to Alex, I think I'll be setting out as much as I possibly can, but we don't really yet have sufficient clarity on the data to be sure now, today, as of this Monday the 15th, exactly what we'll be able to say to you on Monday the 22nd. And that's because the data becomes clearer with every day that passes. We have to continue to evaluate. And also, to be absolutely clear with you, Carl, these decisions we will take in the course of this week, but they're not yet taken. And I would just humbly advise anybody, reading accounts of what we're going to do, or hearing about accounts of what we're going to do at such and such a time in the course of the next few months, to take them with us a pinch of salt, folks, because this is still speculation. When I explain on the 22nd what we're going to do, you'll be hearing it directly from me.
On the specific question you asked me, we're obviously putting a lot of effort into trying to link together data on vaccination status compared to both admission to hospital as a marker of severe disease and of people who die, which obviously happens slightly later. I think the earliest indications would imply there's some effect, but I think it's too early to be able to put a number on that. Obviously, Israel is particularly far ahead in its vaccination program, and there is some evidence of effects. We would expect to see some evidence that is strong enough to be able to put into the public domain in the next few weeks.
Thanks, Carl. Sam Coates, Sky.
Prime Minister, you warned this morning that no vaccination programme is 100% effective. Can you just spell out what you mean by that and the implications of that? And Professor Chris Whitty, what are the implications of this for protecting public health? Do you think some social distancing measures will now become permanent?
Thanks very much, Sam. Well, I'll ask Chris also to comment on this point about the effectiveness of vaccination programmes. But clearly there will be some people, if you have a vaccine that is 80 or 90% effective, whatever the figure is, there'll be at least some people, logically, who will not benefit from it as much as others. We think, and therefore, there's no vaccination program that we know of that is 100% effective in protecting everybody who gets the vaccination from disease. We think, and we have good reason to think, that both the vaccines we're currently using, obviously there are more coming down the track, both of them are effective in offering you a high degree of protection against serious disease or or death, and that's a great thing. We're unable at the moment, Sam, precisely to quantify what that means in terms of driving down the incidence of the pandemic in this country, how fast that can go. And that's why we just have to be cautious at the moment. As Chris was just saying, we've got some straws in the wind. There's some interesting data from Israel, but we just need to wait a little bit longer before we can talk with authority about the effectiveness of the overall program. We know it's going to work. It's the speed at which it works is really what we're still waiting to see, I think it's fair to say.
And in terms of firstly, on the general point about the vaccines, the effect of this, as I tried to lay out right at the beginning, will build. So people's first vaccines, second vaccines, then everyone they meet being vaccinated, and the whole population being vaccinated. In the longer term, we hope the whole world being vaccinated, because it has been repeatedly said and rightly said that no one is safe until everyone is safe. But what that means is the risk will gradually go down. So it won't suddenly move from you having to do everything to nothing. This is going to be gradually, little by little, we will de-risk it. And other bits of medical science, like improved treatment, positive trial results last week, for example, really excellent news about tocilizumab. The effects of all of these together will gradually reduce the risk of this, but whether it'll get it down to the point where it's zero for all time, or whether it'll take it down to a very low level where there's some residual risk, or a level where very occasionally we have to do things in particular points in the season, for example. I think it's too early to say. Clearly, the hope is we get to a point where the minimum effort is used by things like any kind of social distancing, and by far the majority or all of the heavy lifting is done by vaccination, drugs, and the basic things like washing hands, which people should be doing anyway.
What's the name of that drug again, Chris?
Tocilizumab.
Say again?
Tocilizumab.
We're going to get this right. Is it tocilizumab?
Near enough, PM.
Something like that. Okay, this is the one we've got to make sure we get this right.
Tocilizumab.
Tocilizumab, there you go. Okay, we're going to have to know that as well as we know dexamethasone. Tocilizumab, folks, that's the one. And that helps to drive down mortality as well.
On top of the steroids already, another very good trial done here in the UK, thanks to the NHS and the National Institute for Health Research, NIHR.
Tocilizumab. Okay, good, thank you. Jasmine Cameron-Chileshi from the FT.
Thank you. We know that there remain ongoing concerns surrounding vaccine hesitancy and uptake, particularly among ethnic minorities and social care workers. Currently, there isn't publicly available NHS data detailing how many people have turned down their offer of a vaccine. Would the government be open to publishing more detailed information on vaccine uptake, and what specific steps has the government taken to address issues relating to vaccine hesitancy and the spreading of disinformation, particularly among minority groups? And lastly, Prime Minister, you said this morning that the government wouldn't be keen on using vaccine passports within facilities such as pubs. But how does the government intend to prevent companies from mandating that all employees or customers have to have some form of proof of vaccination before being able to use their services? Thank you.
Thanks. Sorry, Sam, why don't you take the first?
So Jasmine, you're completely right. There is a real concern about the hesitancy on the part of some Black and South Asian communities to accept the vaccine offer that they're receiving, either at work if they're a health and social care worker, or as a member of the public. What is happening about that is that there is a huge effort involving community leaders, faith leaders, the way in which the NHS itself is administering the vaccine programme to overcome that. And although the start was slower in terms of the uptake in some of those communities, I think we are now seeing meaningful progress. For example, in Hackney this past weekend, we were vaccinating at a mosque and also at an Orthodox Jewish site after Shabbat had finished vaccinating up until midnight. I was with one of the lead imams this morning in Oxford, who'd arranged for a Zoom with one of the top sheikhs in the world to help explain why vaccines are safe as well as why they work. So I think this will build momentum, and let's face it, part of what we're up against is a dual epidemic. We're up against the pandemic of COVID, and we're up against a pandemic of disinformation and the deliberately sowing of mistrust. And we've got to fight both with equal vigour. On your data point, by the way, we do publish weekly the uptake by different ethnic groups, and at a local area, we share with local directors of public health the uptake in a very granular way while protecting people's medical confidentiality. And we're certainly going to continue publishing more and more data as we had it, while nevertheless, as I say, protecting individuals' and families' own confidentiality.
Go on, yes.
This is absolutely essential, and I think just to repeat in a sense something which Simon said, many people may not take it up immediately, but will take it up subsequently. So it's not a matter of refusal, it's a matter of thinking about it and then actually moving on to do so. All of us think this is critical to support people to make sure we combat misinformation. In fact, the next meeting I've got this evening after this one is with leaders of the medical profession from lots of different ethnic groups to share experiences and share how we can work out how to make sure that people are getting absolutely accurate information that makes clear that the risks of the vaccine are massively lower than the risks of getting this infection, and the vaccine will protect from this infection, and in the long run that is the way we actually need to combat this disease, is by the much safer route of vaccination rather than the very significant risks that go with this infection for many people.
And Jasmine, on your very good question about vaccine passports, which obviously a lot of people are talking about now around the world and in this country, some countries clearly are going to be wanting to insist that people coming to their country have evidence of a vaccination, just as people have insisted, I think, in the past that you have evidence that you're vaccinated against yellow fever or other diseases. I think for purposes of this country and doing things within the domestic UK economy, I think what we'll look at everything, but what we're thinking of at the moment is more of a route that relies on mass vaccination, and as you know, we intend to vaccinate all the adults in the country by the autumn, plus lateral flow testing or testing, rapid testing for those bits where, you know, it is that have been the toughest nuts to crack, as it were, such as nightclubs or theatres, those parts of the economy we couldn't get open last year. And I think that will be the route that we go down, and that businesses will go down. And you're already, Jasmine, seeing lots of businesses using the potential of rapid on-the-day testing as well. I think that in combination with vaccination will probably be the route forward. Though I want to stress to everybody, it is still early days. There's lots of discussions still to be had. Can we go to Dominic Yateman of Metro?
Thank you, Prime Minister. Those in hotel quarantine will be tested on days 2 and 8 of their stay and will have to remain for another 10 days if they test positive. Will they be charged extra on top of the £1,750 if their release is delayed? What if they can't pay? And what mental health provision is being provided for people stuck alone in a room for so long? And a quick one for Sir Simon, if I may. The UK has been vaccinating, excuse me, an average of 435,000 people a day since early January. At the current rate, we could vaccinate everyone over 50 by the end of March and still stay on track with second doses. But the target date is the end of April. Why is this? Do you expect a slowdown in the rollout?
I'll leave that one too. I'll just quickly do the point about people in hotels. Dominic, you're worried about people who may be asked to stay on for longer because they test positive. I think, obviously, you just got to bear in mind that it is currently illegal to travel abroad for holidays anyway. We would expect people who are coming in from one of these red list countries to be able to cover their costs. As for mental health care provision, that is very important, and we'll make sure that everybody has access to the treatment and to the support that they need.
So I would say, Dominic, two things. The first thing is, as you pointed out, as well as opening up the invitations to more than 14 million new people in England in the groups that we're now talking about, we've also got the second doses to administer for those who've had their first dose. And when we look at the likely vaccine supply that we will have available to us between now and the end of April, that appears to be what we can do. If supply increases, then we think we can go faster. But that at the moment represents still a doubling of the number of vaccines delivered over the next 10 or 11 weeks compared to those that have been delivered over the last 10 weeks. So it's a pretty substantial ramp up in this second sprint that we're about to embark on.
Thank you both. Alistair Smoot of Reuters.
Hi, Alistair Smout from Reuters. Thanks for this. Firstly, to the Chief Medical Officer, as we've been hearing, data on the real-world impact of vaccines in reducing deaths, but also transmission, will be key in drawing up this roadmap out of lockdown. Can you go into the specifics on how you work out if it's vaccines bringing down these numbers and reducing transmission, or if it's only falling because everyone is under a national lockdown? And to the Prime Minister, on the World Health Organization's investigation in China into the origins of the pandemic, you've said that you support US President Joe Biden in the need for transparency. Who do you hold responsible for the lack of transparency so far, and what actions are you planning to take? Thanks.
Chris, you want to do the question about
the first one? I mean, there's an extremely long answer. The short answer is initially the studies are being done with something called case control studies, but what we will hope to see in time is we'll actually see in order the rates going down of severe disease and mortality exactly following the order in which people were vaccinated. And I think what we'd really want to get to is the point where we can see, in a sense, with the naked eye, the big effect of the vaccines, rather than having to do quite complex calculations of the vaccinated against the unvaccinated, which is where we are at the moment. So that's very much the direction of travel. But if you look at the data, for example, from Israel, you actually can see the effect. In the UK, we can calculate an effect, but it'll be much better when we can actually see it, when it's big enough to actually be able to see.
Yes. What we are seeing, I think, in some of the early data from the NHS is what looks like a signal in terms of the impact on vaccination, but we really want to let the clock run for another week, fortnight to be able to properly validate that.
And impact on transmission will take longer to determine than impact on mortality and severe disease.
So, Alistair, on your question about what happened and how to and who to hold accountable for transparency, I think it's fairly obvious at the moment that most of the evidence seems to point to the disease having originated in Wuhan. That seems to be where the consensus is at the moment. Therefore, I think we all need to see as much as we possibly can about how that might have happened. The zoonotic questions that people are asking, I think we need as much data as possible. And I think what the world do ask, what are we going to do about it? Alistair, I think what the world needs to see is a general agreement on how we track data surrounding zoonotic pandemics. We want zoonotic research hubs around the world, and we want a general agreement on transparency. And I think one of the attractive ideas that we've seen in the last few months has been a proposal for a global treaty on pandemics, so that signatory countries make sure that they contribute all the data they have, and we are able to get to the bottom of what's happened and stop it happening again. I think that is the sensible thing to do. Okay, everybody, thank you very much indeed. Thank you.